Hello everyone and welcome back to Physi's Medical Education channel. So when people hear the word cancer, one of the first things that often comes to mind is chemotherapy. And when people think about chemotherapy, they often think about things like hair loss, nausea, vomiting, and fatigue. But why does chemotherapy cause all of these side effects? And what exactly is chemotherapy in the first place? So in today's video, we're going to answer those questions and take a closer look at how chemotherapy actually works. In the previous episode, we talked about cancer surgery. We discussed how surgery is often used for patients with early stage cancers, especially when the tumor is still localized and can be removed completely. However, for many patients with more advanced cancers, chemotherapy often becomes an important part of treatment. So today, let's talk about chemotherapy. The word chemotherapy simply means treatment using chemical drugs. These drugs are designed to kill cancer cells or stop them from growing and dividing. But before we talk about how chemotherapy works, we first need to understand the difference between normal cells and cancer cells. Normal cells are highly regulated. They receive signals from the body that tell them to grow, when to divide, and when to have apoptosis, which means cell death. So everything is carefully controlled. Cancer cells, however, are different. One of the defining features of cancer cells is that they lose this control. They continue to divide, continue to multiply, and can eventually spread to other parts of the body. So one of the biggest difference between normal cells and cancer cells is that cancer cells tend to divide much more rapidly. And that is what exactly many chemotherapy drugs take advantage of. Now, how does chemotherapy actually work? Most chemotherapy drugs target DNA. DNA is genetic material inside our cells. Whenever a cell divides, it first has to copy its DNA. You can think of DNA as the cell's instruction manual. Without a complete copy of that manual, the cell cannot successfully reproduce itself. Many chemotherapy drugs interfere with this process. Some damage DNA directly, others prevent DNA from being copied, and some stop damaged DNA from being repaired. Although different chemotherapy drugs work in different ways, their overall goal is usually the same: to prevent rapidly dividing cells from continue to grow and multiply. As a result, cancer cells can no longer keep dividing and eventually die. So when is chemotherapy used? Many people assume chemotherapy is only used for middle and late stage cancer, but that's not actually true. Chemotherapy can be used at several different stages of treatment. Firstly, it can be given before surgery. This is known as neoadjuvant chemotherapy. The goal is to shrink the tumor before surgery, make it easier and safer to remove. Secondly, chemotherapy can be given after surgery. This is called adjuvant chemotherapy, even if a surgeon removes all visible signs of cancer. Tiny microscopic cancer cells may still remain in the body, and chemotherapy can help eliminate those remaining cells and reduce the risk of recurrence. Thirdly, chemotherapy is often used to treat metastasis cancer. Unlike surgery, which is a local treatment, chemotherapy is a systemic treatment. The drug travels throughout the body via the bloodstream. This allows chemotherapy to reach cancer cells that have spread to different organs. Chemotherapy is also commonly used to treat blood cancers, such as lymphoma and leukemia, because this disease affects the body more broadly rather than forming a single tumor that can simply be removed. Now that we understand how chemotherapy works, it becomes much easier to understand why it causes side effects. One of the biggest challenges with chemotherapy is that it does not perfectly distinguish between cancer cells and normal cells. Instead, chemotherapy mainly targets cells that divide rapidly. Of course, cancer cells divide rapidly, but they are not the only cells in the body that do. There are also several normal tissues that contain rapidly dividing cells. and these tissues can be affected by chemotherapies as well. One example is hair follicles. Hair continues to grow because the cells inside the hair follicles are constantly dividing. When chemotherapy damages these cells, hair loss can occur. Another example is the digestive tract. The lining of the stomach and intestines is constantly being renewed. Because these cells divide quickly, they can also be affected by chemotherapy. This is why many patients experience nausea, vomiting, loss of appetite, and diarrhea during treatment. Another important tissue is the bone marrow. The bone marrow produces white blood cells, red blood cells, and platelets. When chemotherapy affects bone marrow cells, patients may develop low white blood cell counts and increased risk of infection, anemia, or bleeding problems. There is also another side effect that patients often overlook: changes in their nails. Many patients notice that their nails become brittle, grow more slowly, or change color during chemotherapy. This happens because nails are produced by rapidly dividing cells located in an area called the nail matrix. When cells are affected by chemotherapy, nail growth can be disrupted as well. Fortunately, most side effects gradually improve after treatment ends. However, it is important to remember that not all chemotherapy drugs are the same. Different drugs work through different mechanisms. Some are more likely to cause hair loss, others are more likely to affect the bone marrow or the nervous system. And not every patient experiences the same side effects. Right now, cancer care has made tremendous progress in helping patients manage these side effects. For example, we now have highly effective anti-nausea medications that can prevent or reduce chemotherapy-related nausea and vomiting. We also have growth factor injections that can help stimulate the production of white blood cells and reduce the risk of infection. Doctors can also adjust chemotherapy doses based on how individual patients respond to treatment. And of course, supportive care, including good nutrition, adequate rest, and careful monitoring, remains an essential part of cancer treatment. So, to summarize, chemotherapy works by targeting rapidly dividing cells. Because cancer cells divide faster than most normal cells, they are particularly vulnerable to chemotherapy. However, some normal tissues also divide rapidly, including hair follicles, the digestive tract, bone marrow, and nail producing cells. That is why chemotherapy can cause side effects such as hair loss, nausea, vomiting, low blood cell counts, fatigue, and nail changes. Understanding why these side effects occur can help us better understand both the strengths and limitations of chemotherapy. And thank you for watching. In the next episode, we will talk about radiotherapy, what it is, and how it works, and whether patients actually become radioactive after receiving radiation treatment. So, see you next time.